Alberta's COVID-19 positivity rate remains high, over 9%, just days before new restrictions come into effect. Good evening, I'm Tara Overholt. If Albertans don't follow the rules for the next 4 weeks, could more be in the cards?
If we put our head in the sand and pretend it's not an issue, we'll wake up at some point in January and we will discover that we have pushed so many COVID patients into our hospitals that we're unable to provide virtually any other health care. And the cost in lives as well would be staggering.
In a Facebook Live Wednesday night, the Premier talking about the cost of not following the restrictions coming into effect this Sunday and not ruling out the possibility of more measures if people don't toe the line. When asked about the wait-and-see approach, Dr. Dina Hinshaw defends the process.
The reality of making decisions about what kinds of restrictions are going to be sufficient to stop the spread is that we know that each of the restrictions that are put in place have other consequences.
Hinshaw says these restrictions are aimed at reducing the number of close contacts on a daily basis.
We also know that the messaging that we are clearly providing to Albertans is our health system is in trouble and we need to work together to save it. And the seriousness of the situation is again underscored by the fact that one of the times of year that typically we're all celebrating with family and friends, we're not able to do that this year.
Today, 1,566 new cases were announced from over 16,000 tests for a positivity rate of 9.3%. There are now over 21,000 active cases. 13 more deaths were reported for a total of 666, and 682 people are in hospital, with 124 in the ICU. Meantime, the City of Calgary and Calgary Police Service say they are ready to work alongside Alberta Health to enforce the public health orders. Now, since the mask bylaw came into effect, 21 violation tickets were issued and 11 tickets under the Public Health Act.